Posterior inferior is made by anterior border of SCM. Anterior border. Anterior border is the anterior midline of the cervical area. I said that you imagine a line which originated from mental protuberance, comes down to arrive to supraesternal notch. Okay? Yes, midline. Anterior border is the anterior midline of the cervical area. The structure which are located in the muscular triangle. In the muscular triangle, we have the thyroid gland, parathyroid gland in this area. Deep to the thyroid gland, we have the trachea. Deep to trachea, we have the esophagus. Okay? The surgeon, for the approach to every of this structure, uses the muscular triangle. Okay?
Yes.
This was the triangle in the anterior triangle of the neck. It was SCM area and it is
Posterior triangle.
posterior triangle. Posterior triangle is also divided to two triangles. This muscle is inferior belly of homohyoid muscle. Inferior belly of homohyoid divided posterior triangle to superior and inferior. Superior and inferior. Superior is also named occipital triangle. Superior is also named occipital. So, say me the boundaries of the superior triangle or the occipital triangle. Anteriorly,
Posterior boundary of SCM.
yes, posterior border of SCM. Posteriorly,
Anterior border of trapezius.
yes, inferiorly, belly of homohyoid. Say me the boundaries of the inferior triangle is also named supraclavicular triangle or subclavian triangle. Yes. The boundaries are anteriorly, posterior boundary of SCM, yes, superiorly,
Posterior belly of homohyoid.
yes, inferiorly, clavicle. Which part of clavicle?
Mid
Middle
clavicle.
part of clavicle. Yes. The structures which are located in the occipital triangle are the roots of the brachial plexus.
Yes.
The roots and the core of the brachial plexus are located in this area. Also, the superficial or the cutaneous branch of the cervical plexus. Cervical plexus has several cutaneous branches which emerge in this area. And the structure in the subclavian or supraclavicular triangle are the external jugular vein. External jugular vein comes here, travel to the inferior, and in this area, in the supraclavicular triangle, here the deep fascia, and insert to the subclavian vein. Also in this slide, you can see the muscular triangle. But the cervical fascia. You know that in the all of the body we have the superficial fascia and deep fascia. But in the neck, we have a separated part of the deep fascia. The superficial fascia of the neck has a structure which it contains several important structures. The first are this vein. Look at this vein. They are superficial veins. They are superficial veins. The most important vein which is located in the superficial fascia is external jugular vein. Find the external jugular vein. Here. It is external jugular vein. The external jugular vein is located in the superficial fascia. Also, superficial fascia in the cervical area contains a muscle. Which muscle?
Sternum.
See this area? Platysma. Yes, platysma muscle. Platysma muscle is a superficial muscle. What means the superficial muscle?
What in the sheath? Spread between two layers of superficial.
Yes, it is located in the superficial fascia. But what is it's different to a skeletal muscle? Yes, the attachment. The attachment of the skeletal muscle, the original insertion is a bone. But here, the platysma muscle originated from a fascia. Originated from the fascia of the pectoralis major and deltoid. Here you have deltoid, here you have pectoralis major. The fascia which covers this muscle is the origin of platysma muscle. The muscular fiber travels superiorly to arrive inferior border of the mandible and also the inferior part of the lip, the angle of the oral cavity, and this area, the skin of the inferior part of the face. So, what is the function of this muscle?
To depress mandible.
It can not depressing mandible, it can depress the angles of the oral cavity, and it can depress partially the inferior lip. Okay, and also it can make a shrinkage in the skin of the cervical area. If it can make a shrinkage in the skin of cervical area, and during the aging, the function of the platysma muscle is not functionally. And if you can see in the grandmother and grandfather, which the skin in this area is very loose and is very shrinkage, yes, it is because of the non-functional of the platysma muscle. The platysma muscle is innervated by the cervical branch of facial nerve. Cervical branch of facial nerve. Facial nerve is number, cranial number 7. Also,
innervated by which one? Is it innervated by which one?
cervical branch of the facial nerve. So, external jugular vein, platysma muscle, and also cutaneous muscles. The cutaneous muscles of, cutaneous nerve, cutaneous branch of the cervical plexus are located in the superficial fascia. These three structures are located in the superficial fascia of the neck area. What about deep fascia? See here. What do you think about this slide, about this fascia? It is deep fascia of the neck. The deep fascia of the neck. The deep fascia in every part of the body covers the muscle, okay, and is located deep to superficial fascia. In the cervical area, a layer which is located just deep to the superficial fascia is named fascia investing or investing layer. Investing means covering. It covers all the structure in the neck which are located deep to the superficial fascia. So, it is a layer, investing fascia. Okay. Another layer is located deep to investing fascia. So I can say that some part from the deep fascia is located to the investing layer and covers another area. For example, see this fascia in blue, okay, is named carotid sheath, covers the internal and common carotid artery, internal jugular vein, and vagus nerve. It is named carotid fascia. It is some part from the deep fascia. Another fascia is here. Another fascia is here. It covers the thyroid gland and the trachea. Is named retrocal fascia. Retrocal fascia. And another fascia, it is the muscles which are located lateral to the cervical vertebral ribs. Cervical vertebra. And this fascia is named prevertebral fascia. So prevertebral fascia, carotid sheath, and retrocal fascia are deep layer of deep fascia. Deep layer of deep fascia. What was superficial layer of deep fascia? Investing. Yes, investing. Okay. See here. What is this fascia? What is this fascia? No, superficial. Superficial fascia is a fatty layer. It's a fatty layer. Okay. This fascia is investing fascia. The investing fascia, I divided it to left and right part. Okay? The left part originated from vertebra, spinous process and the local line of the cervical vertebra, and covers it divided in two layers which cover a muscle. Which muscle? Trapezius, yes. Cover trapezius. When right anterior to trapezius, these two layers attached together again and come anterior. When right to SCM muscle, they separated, this layer separated and covered the SCM muscle, and anterior to SCM, also these two layers attached together to the midline attached to the investing layer of another part. Okay? So, investing layer of the deep fascia covers SCM, trapeze and SCM. Here. Here are the muscles which are located in the paravertebral and perivertebral area. Paravertebral and perivertebral. And this fascia is named perivertebral. This is carotid sheath. This is pretracheal fascia. Okay? Okay, you learn this area. The SCM area. The SCM area from superficial to deep. The skin. After the skin, superficial fascia. The superficial fascia in this area have three structures, yes? External jugular vein, platysma, and cutaneous branch of the cervical plexus. The cutaneous branch of cervical plexus are three or four branch. Four branch. See here. This branch is lesser occipital nerve. Lesser occipital nerve. Lesser occipital. The first you know that all of this branch emerge in the posterior border of the middle part of SCM. Okay? Posterior border of the middle part of SCM, and sometimes for some local surgeries, the anesthesia liquid is injected in this area. The anesthesia liquid injected in this area, and all of this branch are anesthetized and the surgeon can do the exertion. So, the first branch is lesser occipital. Lesser occipital innervated the skin of this area, the skin of the posterior part of the cervix and the occipital area, some part of the occipital area. Another branch is great auricular nerve. Great auricular nerve travels superiorly just parallel to the external jugular vein. External jugular vein is located anterior to the SCM. Okay? So it is the traveling part of the SCM and posterior of the external jugular vein we have this vein, this nerve, great auricular nerve. Great auricular nerve has three branches. Facial branch, here, facial branch which innervated the skin which covered the carotid gland. Here we have the carotid gland, okay? The skin which covered the carotid gland is innervated by the facial branch. Another branch is auricular branch. Auricular branch. The auricular branch innervates the inferior two-thirds of the auricle. Can you see? No. Inferior two-thirds of the auricle. All of this area is an auricle. Okay? Inferior two-thirds at the lateral and at the medial part is innervated by the auricular branch of great auricular nerve. Another branch of great auricular nerve innervated posterior to the auricle. Which process is it? Mastoid. So it is named mastoid branch. It is named mastoid branch. They are the branch of great auricular. Another branch is transverse cervical nerve. Transverse cervical travel transversely to arrive to the anterior area of the neck and then divided to superior branch and inferior branch and innervate the skin of the anterior triangle of the neck. Transverse cervical. Another branch is supraclavicular. Supraclavicular travel inferiorly to arrive to this area. And when it arrives to the superior part of the thorax, it's divided into three branches. Medial, median, and lateral. Medial branch innervated the joint, this joint. What is the name of this joint? The sternoclavicular joint, and also the skin of this area. The medial branch innervated the superior part of the skin of the thorax until second intercostal area. And the lateral branch innervated this area, this joint. Acromioclavicular joint and also the skin of this area. So, this area or inner skin of this area is innervated by supraclavicular nerve. These four branches, lesser occipital, great auricular, transverse cervical, and supraclavicular, are the cutaneous branch of cervical plexus.
So medial branch and innervated which joint?
Medial branch innervated this joint. The sternoclavicular. Lateral branch innervated the acromioclavicular. So, the motor branch of the cervical plexus. Do you know the name of the plexus? The name of the plexus, which is nervus plexus. You have studied in the limb, brachial plexus, in the lower limb, lumbosacral plexus, yes, coccygeal plexus. They are made by anterior branch of spinal nerve. Yes, anterior branch of spinal nerve. Also, in the cervical area, we have the cervical plexus, which cervical plexus is created by the anterior branch of C1 to C4. C1, C2, C3, and C4. This made the cervical plexus. The cervical plexus has motor branch, cutaneous branch, and also it has communicating branch. The communicating branch communicates with the sympathetic trunk, with the parasympathetic nerve, and with the, for example, hypoglossal nerve. They are communicating branch, communicate with any of the nerves in this area. Cutaneous branch was 4 branch, yes, and now the motor branch. What is the name of the motor? The motor branch innervated a skeletal muscle. Yes, a skeletal muscle. So, what is this nerve? Phrenic nerve. Yes, phrenic nerve is made by C3, C4, and C5. But the important part of phrenic nerve is from C4. Important part is from C4. The phrenic nerve innervated diaphragm. Yes, diaphragm. And also, it has some sensory branch for the pericardium, and also for the parietal pleura. Parietal pleura. It is one branch of the cervical plexus. Another branch